So the psychological stress cancer patients undergo ultimately is going to affect their mental as well as their physiological health. So following the presentation, you should be able to understand the effects of on the body that the stressors cause and the ways that we can help to fix this problem. So, what is psychological stress and how is it caused? Psychological stress is going to describe what people feel when they're under mental, physical, and emotional pressure. So, this stress can be caused by daily responsibilities or routines such as school, or it can be caused by more unusual events like traumas or illnesses in your family or a friend, something of that sort. And so people that feel like they aren't able to manage or control changes that are going on in their life, they're in distress. Typically you see this in cancer patients. And distress has become increasingly recognized as a factor that can overall reduce one's quality of life. So cancer diagnosis and treatment can be accompanied by profound physical, emotional, social, and occupational, as well as financial stressors, and it can cause anxiety and depression. So your body's going to respond to physical, mental, or emotional pressure by releasing hormones such as epinephrine and norepinephrine. Some of you may know what this is, others not. It's going to increase your blood pressure, speed your heart rate, and raise blood sugar levels. So these changes are typically helpful to a person when there's a threat. So they're going to be able to move at faster speeds and greater strength. So typically, you've probably seen on the news where a woman's able to lift up a car off of her child. That is norepinephrine and epinephrine working. Research shows that people who experience intense and long-term chronic stress are going to experience digestive problems, fertility problems, urinary problems, and a weakened immune system. So this means that they're constantly producing epinephrine and norepinephrine. And it's good in short-term events, but when you do it over a long term of time, it can be really damaging on your body. It's called a fight or flight response, by the way. Unfortunately, a majority of cancer patients are going to undergo this chronic stress, and it negatively will affect their bodies. They're more prone to viral infections or the flu, or common cold, headache, sleep trouble, depression, anxiety. So that's why you typically see cancer patients getting sick a lot, specifically. So cancer patients are going to undergo a lot of stressors like chronic depression and isolation, as well as just many other things that can lead to disease progression. The stress of cancer actually can cause 1,400 different chemical changes in your body. To the body, stress is a perceived threat to their survival, and so when the stress is sustained over time, it can decrease their healing and survival rates. Evidence from experimental studies suggests that psychological stress can affect a tumor's ability to grow and spread. And I thought this was really cool, so I'm going to tell you all about some studies that they did. One study, they had a mouse, and they put a human tumor on the mouse, and then they isolated it from its other mice, which is considered stress. And they actually were able to see the tumors grow and spread on the mice. Another one actually shows that, according to the 2010 National Health Interview Survey, that cancer survivors are twice as likely to have disabling psychological problems compared to adults without cancer. So 10.1% of cancer survivors reported poor mental health compared to only 5.9% of adults without cancer. So this is because they have so many challenges during post-treatment. They have a complete shift in their life. They aren't getting the medical care they did. They're worried that it's going to recur. They're not having their family kind of hovering over them. They're lonely. Their life's just completely changed and they're going back to work. So all these things are really stressful, and it can cause them to be depressed, have anxiety, which ultimately has their immune system down and helps them contract diseases more easily or sicknesses. So during the first 1 to 3 years of treatment, that's a really critical period that they monitor your health. And then I kind of use this picture, has stress and then a weakened immune system, just to kind of show how the vicious cycle is. The more stress you're going to get, the more stress hormones you're going to release, the more weak your immune system's going to be, the more likely you're to become more stressed on your body and your mental health, and it's just going to continue to go and go and go. Exercise helps cancer survivors and patients cope and recover from treatment and has been shown to improve the health of long-term cancer survivors as well as extend their survival. So physical exercise is going to benefit through the spectrum of cancer. In a growing body of research, they investigated that exercise in cancer patients had dramatic improvements in their physiological and psychological functioning, and it was documented in patients participating in exercise programs like Survive and Thrive. So they have evidence that shows their quality of life goes up, They have the cancer-related fatigue that a lot of them experience is not as prevalent. They have better physical functioning, better body weight and composition, increased muscle strength and endurance, better immune function, and cardiovascular fitness. And all of this is going to help their immune system stay up, less likely to get sick, less likely for their cancers to spread and grow, less likely to be tired, all of the positive effects that we want to happen in their bodies. So it can also reduce the risk of cancer reoccurring, second to cancers and chronic diseases that would prolong their survival.